We have a great topic, as I said, relief from women's health concerns, just a whiff away. I love it. I love the title to today's webinar presentation. And Cindy, as you know, you can adjust the slides there down at the bottom left-hand corner of your slide. If not, I will make sure I help you with that. So congratulations to everybody for being on this fantastic webinar. You're in for a treat. So welcome and thank you, Cindy. I'll turn the time over to you.
Okay, great. There's a great picture of you too, Brian,
Okay,
on that slide. How do I
you.
get control? It says, it doesn't mention that I have control of that.
Let's try that. There you go.
Now I can. Great. Okay. Hello, everybody, and thank you for the introduction. I am really excited today to be sharing this information about women's health concerns and getting relief from them with our essential oils. So what we're going to do is I'm going to do the presentation in 3 parts. And in the first part, I just want to share with you some of the more interesting research that's been done on essential oils in regards to women's health concerns, as well as things that are really practical for us, you know, as far as menstrual cramps and things like that. For instance, let me advance the slide here. Oh, that's who I am. Let's go to the next one. Here we go. There was one program in particular that received an award from the Prince of Wales Foundation for Integrative Health, and it was in the good practice category, because in 2003, these group of midwife aromatherapists undertook training the hospital staff in a United Kingdom hospital. And these midwives ensured that this training was based on currently available scientific evidence, especially since so many of these essential oils are contraindicated during pregnancy. And that's what we'll talk about later in the presentation. But in this study, they created what you can see on the slide is a labor kit. And it was used with these common essential oils. And at the end of the study, it showed, quote, the service was effective in normalizing childbirth and increasing the satisfaction of moms in respect to that labor experience. So essential oils, yay. Now, another study looked at adolescent women who were experiencing dysmenorrhea. Now, dysmenorrhea is simply derived from the Greek word dys, which means abnormal or painful or difficult, and then meno, which is month, and then rhea, of course, is flow. So we see rhea in diarrhea, again, the flow. Well, these women in the study only used lavender and eucalyptus topically several days before their cramps were expected. And at the end of the study, the results showed a significant reduction in painful cramping. So the essential oil, of course, lavender, it's thought to increase circulation, but also has what they call anti-convulsive properties. So, you know, think of a cramp as almost convulsing, right? So anti-convulsive properties. And it also, of course, everyone knows that lavender has relaxation and sedative effects on the amygdala, which is that emotional center of our brain. Now, in this particular study, they took nurses who had menstrual cramp pain that was over 5 points on a scale of 1 to 5. So these are the women that they used. And what they did is they used a 3% concentration of 3 oils, rosemary, clary sage, and geranium, and they massaged it into the lower abdominal area for 10 minutes. And this practice is that one we just talked about with these adolescents. Both resulted in a reduction of pain. Now, if you're wondering what a 3% concentration is, what does that mean? I'll show you a slide a little bit later, but a 3% concentration is approximately 20 drops of essential oil in 2 tablespoons of a carrier oil. So we'll talk again about that in just a few minutes. And also feel free to take screenshots of this if you know how with your computer, or just reach for your cell phone and use your cell phone for some of those images that you really like. So let's talk about sleep. The National Sleep Foundation has reported that 68% of women between that 4th month of pregnancy and throughout 2 months after the baby has been born, so that's a good 7 months of their lives, are reporting increased sleep disturbances. And this is attributed to, of course, to these hormonal changes going on. But in this particular study, all they did was diffuse orange peel essential oil before bed, not during the time they were sleeping, but literally before bed. And this resulted in an improvement in the quality of sleep because of orange's sedative and anti-anxiety properties. Sorry about the beep you just heard. Okay, this is one of my favorite of all is thyme oil. Now, thyme, it's amazing what this oil can do. The researchers, and there's a lot of it on thyme, have found that thyme has progesterone balancing effects, as well as, of course, having the ability to improve progesterone production in the body. Now remember, both men and women today are low in progesterone, which of course I believe is due to the endocrine disrupting environmental chemicals that we are all exposed to, because these environmental chemicals are, most of them have an estrogenic base. So we are getting too much estrogen in our bodies, and it's messing with our testosterone and our progesterone levels. So these low progesterone levels have been linked with infertility, with polycystic ovarian syndrome, depression, as well as other, of course, hormone imbalances in the body. So improving progesterone balance with thyme is actually a really good choice to naturally balance the body's hormones. And I believe it should be the first step before someone resorts to a synthetic treatment. Of course, unless it's a medical condition that needs attention right away, but maybe the first step before resorting to hormone replacement therapy, because of course that will do nothing but mask the symptom while possibly, as you know, developing diseases in other parts of the body and causing serious side effects. And when it comes to sandalwood, this plant also has hormone balancing effects, but this time in testosterone levels in both men and women. And also, of course, it has a really amazing scent. And it's been suggested that even men with low testosterone, again, before resorting to synthetic testosterone, of course, pending any medical emergency, but men with low testosterone can add a few drops of sandalwood oil into their deodorant or lotion. So it's not only a great way to smell good, it's also a way to help improve their libido and their hormone levels. Now, rose, of course, can lift anyone's mood, even the flower itself. But what rose does is it improves the serotonin levels. Serotonin is that feel-good neurotransmitter in the brain, that feel-good brain chemical. Now, frankincense, on the other hand, is one of the best oils for the functioning of the thyroid gland. And frankincense is also good for autoimmune disorders because it has anti-inflammatory effects and its ability to lower cortisol levels. Now remember, cortisol is that stress hormone. So these are other research papers that are going on using rose and frankincense. And while we're on the topic of lowering that stress hormone cortisol, research has also shown that lavender and chamomile can also naturally lower that cortisol level because they're effective at reducing stress. So this is one of the ways that we can help the body when it's trying to overcome disease, is to lower that stress level. Now, this study was enormous. This was an 8-year study. They had over 8,000 women in this study. And what they did is they explored essential oils in regard to, again, labor and childbirth. In other words, how to ease the pain ease any of the nausea and ease the anxiety. So what these women did, or probably their midwives, applied rose and lavender, but in a very small amount. They put just 4 drops. So probably, 1 drop of rose, 3 drops of lavender in that 10 milliliters of a carrier. And again, the results showed it was surprisingly effective. But you're wondering now, how do I measure 10 milliliters in a carrier oil? This is a good measure page for you. So the 10 milliliters would be about 1/3 of an ounce or 2 teaspoons, whereas 30 milliliters is considered an ounce or 2 tablespoons. 60 milliliters is 2 ounces and 4 tablespoons. You can kind of see what that measure would be, but let's also take a look then at dilution, because previously I talked about a 3% 3% dilution. Here's what a 5% dilution or a 10% dilution would look like. Now, at the bottom of this slide, you're going to see a link to the National Association for Holistic Aromatherapy. That is a link that you can go to for other, I have to say this carefully, other populations that aren't listed on our slide. In other words, you might find someone outside of that age group that you're interested in knowing a dilution rate for. That would be a great link for you to explore. Okay, got it? I'm sure you do. Okay, so in the second part, what I want to do then is I want to show you, out of all the research being done, what the most common essential oils are that have been studied in regards to women health concerns. And what we're going to start with, of course, is Clary Sage. Now, all of the literature available on this plant's oils show that it has multitude of therapeutic properties. It's used for any type of problem when it comes to the womb or the uterus. It can help to regulate menstrual periods. It can help to ease tension and muscle cramps. And it's even been touted as having a seductive or aphrodisiac type of activity. But it's interesting, it's also even helpful in controlling the production of sebum. So that is what we have a lot of when we're making oily skin. So I'm not saying that it reduces the sebum, it controls the production. So it's useful then for both balancing dry skin as well as oily skin. So think acne or dry wrinkles, and it's even used on cellulite. And some of the recent studies, as I've mentioned, help that it shows reduce that cortisol, that stress hormone that we secrete. In fact, there was a very small study in 2014 with postmenopausal women in their 50s, and it showed that by simply through the inhalation of Clary Sage, it was able to reduce cortisol levels by 36%. Through inhalation, which of course is aromatherapy, right? So the ability to reduce cortisol levels by 36% while also improving their thyroid stimulating hormone, that, their thyroid hormone levels. And remember that the thyroid itself is another one of our, quote, emotional glands. So as it's helping to reduce the cortisol level, it's also kind of settling down that thyroid. And some of the women in the studies, they had been previously diagnosed with depression, but by the end of the trial, the researchers said that this Clary Sage oil had a statistically significant antidepressant effect and thereby improved mood. So really one of the biggest benefits of Clary Sage is, to me, is that it balances out that estrogen production in the body. And again, I want to point out that these environmental toxicants that we are exposed to, about 80% of them have estrogenic properties. So if we can balance out this excess estrogen in our bodies, it's really going to help with things like infertility and PCOS and even estrogen-based cancers, because these are all caused by an excess amount of estrogen in our body. And again, I believe partly because of our exposure to these environmental chemicals. So Clary Sage is really helpful here as well. Now, geranium, of course, is one of the best natural perfumes that we have. It's generally used to help with anxiety and stress-related problems, but it's also used on skin conditions such as dermatitis or eczema or aging skin, as well as even fungal infections of the skin. It's an important oil when it comes to menopausal problems as well as endometriosis. And there are some studies that are showing that geranium is used as an adjunct therapy. That means along with another therapy. So an adjunct therapy in both uterine and breast cancer treatment to help patients cope with pain. And on top of all of that, it's even really effective as an insect repellent. Now, the research shows that excessive vaginal discharge or leukorrhea, as well as cystitis, have been successfully treated with eucalyptus. And you may recall in a previous slide that it was used along with lavender to decrease the discomfort of those painful cramping. But apart from helping with women's particular health issues, eucalyptus is also used for nerve pain. It's called neuralgia, or even headache pain, or muscle or joint pain. And interestingly, it's also been shown in the research to boost one's immunity against the flu, against colds, and as well as those childhood diseases like measles and chickenpox. But still thinking immune, it's also used for throat infections and coughs and bronchitis. It's used for asthma, for sinusitis, and excessive mucus production. So think about that. It's excessive vaginal discharge, excessive mucus production, kind of get an idea about how it works. And when it comes to the skin, eucalyptus, like lavender, is used on burns, but eucalyptus is very effective against herpes outbreaks, cuts, wounds, and even insect bites. So be sure to include, if you're making your own homemade insect repellent for the summertime, be sure to include the eucalyptus, of course, along with your Clary Sage. Now, we've talked a little bit about lavender, and its ability to reduce anxiety and sleep disturbances, as well as improving our feeling of well-being, but it gives us, or it supports, let's say, our mental alertness. And interestingly, again, in the research, it's even been shown to help suppress aggression and anxiety in individuals by just calming that amygdala, that emotional center of the brain. And of course, lavender has a rich history as an antibacterial and antifungal. In fact, they used fresh lavender plants in castles. They would strew them onto the floor as an antifungal, antibacterial, and to deodorize the rooms of castles where the sick had been. So a long history of its antimicrobial effects. And again, some of the research even shows that even though it's useful against many types of bacteria, itself, but when antibiotics fail to work, there has been some success with using lavender, and yet they don't know why. Of course, they don't know the exact mechanism, so they haven't established that yet, but who cares? If it works, it works. So again, we all know it's been well documented for the treatment of burns and scrapes, but also in the production of new cell growth, which again is why it's so important for those burns to regenerate those new cells. But we used it on menstrual cramps, so think of it also on painful muscles, or again, boosting that immune system. And as we saw in that first slide, lavender was applied by those midwives. And again, it was interesting because they chose lavender because of its safety, its lack of side effects, and the simplicity of just applying it neat without any carrier oil, as well as being really cost effective for their patients in the UK. Now, lemon, of course, has its antiseptic, detoxifying properties, as well as astringent properties. And an astringent is simply something that tightens and tones. It's used for blemishes on oily skin, but it can also brighten and rejuvenate dull skin. So we see a lot of lemon oil or lemon essential oil added to female lotions for people who are aging, I should say. But lemon is also helpful in boosting the immune system. It can accelerate the white blood cell production in the body. And there was a recent clinical trial that showed it was good in relieving the first stages of labor pain, that it helped with the nausea and the vomiting accompanying that labor pain, but also having mood elevating properties. So another just tremendous oil that we love. In fact, that's one of my favorites. Now, peppermint has antispasmodic properties. So again, that's a really good one for any type of muscle cramping or muscle pain. But think again for that menstrual cycle when we've got that excessive cramping going on, or to rub it around the head and the temples, of course, for headache pain. We've been doing that for what, 40, 50 years now. But it's also used in topical preparations for those painful muscles and arthritic problems. Now, if you get a mosquito bite, it's a wonderful thing to relieve the itch. It can also relieve the itch for ringworm or scabies or poison ivy or poison oak. And it does have very potent antibacterial, antifungal, antiviral properties when simply inhaled when there are sinus or lung congestions. So again, aromatherapy, right? We're breathing the aromas of these plants. Now, chamomile is also used on those muscle spasms and muscle cramps, as we saw in the previous slides. But because of its ability to work on pain, we can use it for headaches and joint pain and arthritis and sprains and all of those types of painful things. It too has anti-anxiety properties that can help relieve that stress, and we can help to work on depression and worry and an overactive mind. And sometimes when people are trying to go to sleep at night and they've got that overactive mind, they simply can't bring on the sleep. So we all know that sleepy time tea is pretty much Roman chamomile to help us fall asleep and stop that busy brain. But Roman chamomile too is helpful with psoriasis and eczema, for boils, for sunburn. It's useful for colds, and another one that we can use topically for an insect sting. Rosemary, we could do a whole webinar on. I'm telling you, the research on rosemary is just, it's really off the charts, probably more so on this plant than any of the other oils that I have seen. Rosemary, of course, when we're talking about women's health, it has excellent skin tonic properties. It will help to have a soothing effect on that cramping, but it's also used as we go through menopause and maybe our hair thins. I know that Nora Weigel has a wonderful recipe for her growing back hair using rosemary oil and a couple of other oils. But rosemary has been shown to stimulate hair growth, but also as a treatment for dandruff or greasy hair. So these days you'll find rosemary in a lot of shampoos and in a lot of conditioners and things like that. But rosemary is also helpful to relieve constipation, which oftentimes can be of a hormonal balance issue. But it also works as toning the liver and the gallbladder. Now, in some of the latest human trials, and this is why it's getting so much notoriety in research, is because rosemary has been shown to be effective for dementia and is now proving to be especially helpful in Alzheimer's disease patients for improving the cognitive function in these patients. So, you know, we get older and the estrogen isn't there to protect our brain. And so, you know, rosemary is one of those wonderful plants that we should remember to keep on hand as much as possible. tea tree oil is used for vaginitis, cystitis, pruritus, and pruritus, by the way, is the sensation that gives us that sensation to scratch. So think about applying tea tree oil to an insect bite as well, but it's useful for acne. It's useful for cold sores. Another one we can put on burns. Another one we can use for dandruff or oily skin or herpes outbreaks. There have been a lot of very well-defined clinical trials that have been done with tea tree for herpes, and it's showing very promising results. As far as an immune category, tea tree is used for tuberculosis, for any kind of cough or bronchitis or asthma, whooping cough, excess mucus production, all of that family in the respiratory tract, as well as just colds and fevers and flus, as well as chicken pox. Now, ylang ylang is antidepressive in nature, but it has been claimed to have euphoric properties and gives a person a real strong feeling of well-being. They did a really interesting study with postmenopausal women, very small. There were only 34 professionals in this study, but they did a very small study, and they took women with postmenopausal syndrome that were suffering from low self-esteem. And they used ylang ylang. And what happened was, it was a significant reduction, or I should say increase, in a feeling of well-being in these professionals who weren't feeling so good about themselves, let's say. There was another one carried out in Portugal. I think it's on the slide. Yes, it is. In Portugal, they were nurses, and this study showed that ylang ylang was effective in relieving anxiety as well as increasing self-esteem. So two different studies showing clear evidence that the oil of this plant can lead to a significant alteration in our self-esteem. And along with that, it also showed positive results for depression, anxiety, stress, and even a lack of interest in intimacy, we'll say. But let's not forget some of those other amazing oils that we saw in the slides previously. So for instance, rose with its serotonin ability, and orange helping us to go to sleep, and thyme with its progesterone balancing effect, sandalwood with its testosterone balancing effect. So keep all of those in mind as well. So now that we understand some of the research that has been done, the recent research, and how they have applied certain oils for certain conditions, what I'd like to look at now are particular health concerns of women and how we can use those oils. And we'll begin, of course, with PMS. So the pain associated with PMS usually begins, as you know, if you remember, just before or just as the menstrual bleeding begins, and it gradually diminishes about, within 1 to 3 days or so. And the pain is usually intermittent. It can range from mild to really pretty much disabling for the day. About 15% of our adolescent girls are reporting severe dysmenorrhea. And this problem is the leading cause of recurrent short-term school absenteeism in these young girls in the US. And when it comes to out of school and you're now working, it can also seriously decrease a woman's productivity and creativity and performance overall in women at work. So note that the oils used for PMS, they depend on the symptomology of the individual woman. So for instance, a woman who experiences PMS with fluid retention might benefit from juniper or lavender when it's in a bath. Whereas women who experience PMS with stress, or they have a lot of tension, can benefit from neroli or ylang ylang or clary sage as a massage on their abdomen or chest as they need to. So peppermint, frankincense, rosemary, bergamot, they have all been used for pain and emotional challenges due to PMS. Now, there was one study that showed a significant improvement in PMS symptoms. And remember, PMS can be both physical and emotional. It really can. So when they say a significant improvement in women, they mean overall, both physical and mental. So in this one study, they used 3 drops of geranium, 3 drops of Clary Sage, and 4 drops of lavender in just a teaspoon of a carrier. And they applied that to their back and abdomen every 4 to 6 hours as needed. And so you can kind of see, I think, as it's clear to see that there is not a one size fits all or just one way of doing this. There are so many different oils and so many different dilution rates and things. One of the best ways to know which is right for you, I believe, is to smell the oils and see which ones that you're attracted to and see what works for you. Maybe it's every 4 hours, maybe it's every 8 hours that you need to reapply. Now, there was another study done on menstrual cramps. They used Clary Sage, Chamomile, Angelica, and Yarrow that showed very significant promising results. And another formula again, one size does not fit all, but another one was using 5 drops of Roman chamomile, 5 drops of Clary Sage, and that, just those 10 drops in a teaspoon of oil. And again, applying it 4 to 6 hours is needed. So not only massaging these into the abdomen in the lower back, but remembering to put them in a bath or with some Epsom salts, or you could use them as a compress, right on the area in pain as well. Now, women who experience breast tenderness, there are a couple of different things that we can do here. One on the slide shows using 2 to 3 drops each of lavender and chamomile, massaging that gently on the tender areas. But also, there's another formula saying that we can use geranium oil, juniper, and evening primrose oil as a massage 4 times a day. In fact, another study just used lavender and Roman chamomile. So there's just lots of different ways that we can do this. What I've found promising for breast tenderness in the women that I've worked with is using primrose oil as the carrier, but also taking primrose oil internally. And that was really helpful. In fact, for myself, when I went through menopause, I'm almost ashamed to say over 27 years ago. So there we go. All right, candidiasis. Using plant oils with antifungal abilities is one of the best ways to reduce the growth of this overgrowth, I should say, of candidiasis. Now, or candida. Of course, keep in mind the gut bacteria. We have to have the proper balance of good bacteria versus the unsavory or the undesirable bacteria. So if you're not familiar with that, last month with Nature Sunshine, we did a webinar on the gut microbiome, and it was showing you the development of how it starts prenatally in the womb, how it develops all the way through the aging process. And you can watch that today. It's on my YouTube channel. So when we get to the end, you'll see my YouTube channel, and you can just watch that. And balancing your gut microbiome will make you less susceptible to candidiasis. Now, of course, hot flashes seem to be one of the most common complaints of women undergoing menopause. In fact, 50 to 80% of menopausal women worldwide experience this sometimes very uncomfortable symptom. The highest prevalence, of course, of hot flashes is found in the Western countries and the lowest in China and the Asian countries, but nonetheless, it is still problematic. Now, if this gets excessive, it can absolutely decrease the quality of our life. And of course, the primary treatment is hormone replacement therapy. And sure, that can help reduce your hot flashes by 70 to 80%. But we have to consider the side effects of HRT, including an elevated risk of breast cancer or blood clots or high blood pressure, vaginal bleeding, gallbladder disease. I mean, this is just a few of them. And so there are a number of women that have gone the route to non-hormonal therapy, such as aromatherapy. And again, every person is individual, and some women just absolutely may need that pharmaceutical. And if they need it, go ahead and use it. But stepping and using nutrition and then going to the plant kingdom with the herbs and the oils should be the next step, followed by pharmaceuticals if need be. And that's the way it works in the office where I work with a medical doctor. I've been with him for about 27 years now. So that's our path anyway. Now, menopausal symptoms might need estrogen support. Remember, we talked about some of the oils that provide that support, including Clary Sage, but also fennel and geranium. And there's also a really good all-purpose formula for relieving menopausal symptoms used in research for these hot flashes. And they use neroli and mandarin and Clary Sage in a carrier oil, and they massage it to the solar plexus. So do you know where that is? That's kind of above the belly button, in other words. Remember that using oils with estrogen-like properties are truly best avoided in women who have estrogen receptor breast cancer. There just isn't enough research yet to really properly show that these are safe. So keep that in mind. But also, some menopausal symptoms might require progesterone support. And we talked about how time can balance progesterone. It really is important when recommending oils to women that you should investigate their properties. I mean, for example, sweet marjoram might be good for menstrual cramps, but it's also an aphrodisiac, and that might not make it a very good oil for some women, right? So lavender, oh my gosh, we've talked a lot about lavender. It's been really widely used in the fields of obstetric, gynecology, as well as pediatric. But it's also been used for relieving pain in labor and post-cesarean pain. It's used for, as we mentioned, the dysmenorrhea. It helps to reduce postpartum depression and anxiety. It can help to minimize muscle pain, hot flashes, depression, and melancholy. Melancholy is when we're sad for no apparent reason. There's no cause and we're just sad. That's how we medically define melancholy. So we can use lavender for that as well. And the simplest way to use lavender oil really in these cases is, remember, inhalation, aromatherapy. Just open the bottle and smell it every time you feel a hot flash coming on, or keep a spritzer on hand and lightly spray your face with it if you feel that. So here are some more ideas for oils used in menopause. Remember, we can apply them to our temples, the back of our neck, the base of our spine. We have a recipe for a menopausal spritzer for hot flashes, and it's 10 drops of Clary Sage, 10 drops of geranium, and 5 drops of lavender. And you put that in distilled water, maybe add a drop or two of rubbing alcohol in a 1/4 cup of water, and then close your eyes and spritz your face and body as you need it. So 10 drops of Clary, Clary Sage, 10 drops of geranium, 5 drops of lavender in some water, a little bit of rubbing alcohol or whatever you use to disperse the oils, and then just spritz. Now, when it comes to urinary continence, there are several actions that we can take, such as soaking in an Epsom salts bath with lavender or lemon or bergamot or all of them. We can also add the oils to a carrier and massage it on the feet, or we can diffuse it for several minutes before going to bed. We can put it into a carrier and rub it just where the womb is, where the bladder is. We can rub it on our kidneys. We can do whatever we like. These oils are completely safe to use topically. Now, when it comes to water retention or edema, It's another aromatic Epsom salts bath, but this time with patchouli and or helichrysum. We can also create a blend with those listed on the slide and create a massage blend and apply that topically. And to give it more oomph, I should say, you can add some cinnamon or rosemary to it. And again, just massaging it onto the areas of the body that are swollen to increase circulation and help to disperse some of that water that you have retained. Now, for stretch marks, one can apply lavender neat, and that just means with no carrier oil. Lavender and tea tree can be applied neat. All of the other oils should have a carrier with them. They could possibly burn the skin or be just too strong. So we can apply lavender neat, or we can mix it with the other oils and put them in a carrier and apply them topically. Now, infertility. As the slide indicates, researchers had some, and I'm going to say some, success in regards to infertility by regulating these irregular periods. So that was the problem in this study, is irregular period. So what did they do? They created what is known as a 10% dilution of rose, geranium, and clary sage. So of those three, that equated to about 50 drops of essential oils in 2 tablespoons of a carrier. 2 tablespoons is an ounce, and that's a lot of oil. So rose, geranium, and clary sage, and what they did is they applied that mixture to the abdomen and the back from the last day of bleeding in their cycle until ovulation. So they did it for however long that period is. If it's 11 days in some women, 14 days in other women, it might be, 20 days in other women. So it's from the last day of bleeding until ovulation, and then take a break again until the menses begin and the bleeding begins again. There are other essential oils that are good for infertility: are ylang ylang, clary sage, geranium, fennel, even anise, cypress, and rose. And these oils are said to decrease stress and anxiety. And of course, by getting rid of that anxiety and stress and just such a huge concern about, I need to get pregnant, I want to get pregnant, I really want to have a baby, by calming them down, getting that amygdala to calm down and stop producing all those stress hormones in the body, these oils can and possibly may aid in conception. But again, don't forget about inhalation too. So as you're going through some of these oils, you might want to make a perfume out of them. So maybe it smells lovely to you, and so much so that you want to wear it during the day. Well, here are the rules. Well, actually, there are no rules, really. But here is what is suggested. You just want to start small with no more than 2 to 5 oils. And then what you're going to do is you're going to allow that blend to age before changing it around a bit. Give it a while, give it a week or more to really age, and then sniff it again and add more of what you'd like to create that perfume that you're interested in using medicinally. But we have to talk ethics when we are using essential oils. And of course, Hippocrates said, first, do no harm. I want to emphasize, always practice extreme caution in pregnancy and breastfeeding. When you are working with a woman who is breastfeeding and nursing, you have to learn about the oils that are to be avoided. And I'm going to give you some books that I think are really good, because you need to understand those safety guidelines. There are other safety guidelines as well, such as not inhaling eucalyptus or Roman chamomile during an asthma attack. Whereas frankincense is a wonderful thing to use to expand the lungs. So different things, and we want, these are potent. These are potent oils. So we have to use them with respect and be a little bit knowledgeable about them. So again, using extreme caution in pregnancy. These days, these new moms, and I don't blame them, but these new mothers are often fearful of pharmaceutical medications for themselves, or concerns for their infant who's being breastfed. And so what they're doing is they are medicating, I should say, or self-seeking alternative therapies to treat those. But natural does not always equate to safe. We have to know those safety guidelines. For instance, here are just some of the oils that do need to be avoided during pregnancy, mainly because of their abortifacient and emmenagogic properties, meaning bleeding to terminate the pregnancy. So we have to be very cautious and know our guidelines. Also, when we talk about do no harm, understand this, that when you use essential oils, well, let me put it this way. Don't use an essential oil on an infant under the age of 3 months, no matter what the dilution percentage is. It simply is not recommended. Their skin and their respiratory system are still developing. And think about this, using essential oils, mom who is nursing or an infant, these oils may interfere with the bonding that occurs with that infant and the mother by masking that mother's own scent. We know that infants know who their mom is and their dad and their family members through that particular scent. So we don't want to dilute that. Again, we have to use the safety guidelines. One of the safe ways to do it is for the pregnant mom is just to use an aromatherapy sock. And it might be a good gift, and you can just take a tube sock and fill it with white rice and infuse it with some of the safer essential oils like lavender and what else. But this might be something that she could use, and she just warms it in a microwave, can put it on her back or on her neck. So on the next 3 slides, I'm going to show you, and I believe you'll have copies of these slides through Nature Sunshine, but I want to show you some of the references and why I use them and what they're all about. These are all journal papers that have, or the first one is, I think, let me see. One of them is, oh yeah, the maternity unit. Yes, the first one has the information on the maternity unit labor kit that was used. But some of these other research papers are the ones that I use to get the information on menstrual pain and anxiety and depression and sleep quality. And there are more references on studies looking at hot flashes and pregnancy and labor and that postpartum time of life. But the second one here, Bill Fifield, this is a good book to have, The Integrated Guide to Essential Oils and Aromatherapy. A lot of really great information, as well as, second to the last, Melissa Ferris, her Aromatherapy Guide to Essential Oils. Another very good book, but note again, you're looking at that link, the very last bullet point on this reference slide, to the National Association for Holistic Aromatherapy, where you can get more information on the populations of age groups that aren't in our program today. And I urge you to look at that. Last slide that we have here. Let's see, whoop, didn't want to go there at all. I clicked it twice. Let's go back. It says my internet connection is unstable. Well, if I can go back, can you help me go back a slide, Brian? Can't go back. Let's see. Oh, well. Oh, well, I'll just tell you, when you get the slides on that last reference slide, go back, go forward let me see, Brian, go forward.
Okay, this is the last reference slide that I see.
One,
this is the third.
So. There, stop there. That's the one I want. Yep, I want that one. Yep, okay. That's the one I want. So the second reference, whoops, moving again. I don't know what's going on. Can you put it onto the one that starts out Wills or something like that?
Walls, D.
Yeah.
D Walls.
Yep.
Oh, that's a good name. Wall's a good name.
Brian Wall. There it is. Okay. Don't click.
No click.
Don't click.
We're good.
The second one, if you can call up this particular reference, it shows it shows emphasizes the importance of safety in different, in childbirth and in infancy, and the importance of safety when using aromatherapy, while the very last reference is another tremendous book. So you might not need all of these books, but go on Amazon or you buy books and do a what's called look inside and see which one you feel is good for you, because this is another very good one, and I used it in that presentation. So there, Brian, if you can click to the last slide, and I can show them where they can find me on YouTube and Facebook. Many of you are already following me on Facebook, which I'm so happy, because every day I post something on the environment, and it's not a problem. And if it is a problem, I always give you the resource solution. None of my posts will be all bad news. If it is bad news, I'll show you how you can fix whatever it is that's happening. So yesterday I gave information on how a person could determine which recycling codes had safer materials or not. So feel free to follow me on Facebook. I'm on LinkedIn, Instagram, Twitter, and that is my YouTube channel. It might just be easier just to go to YouTube and type in Cindy Clement. You might find it easier that way, because that's a pretty long link. But nonetheless, it's just been a delight for me to talk with everybody today, and I'm gonna hand it back over to Brian.